Good morning, everyone, and welcome to today's Navigated COVID-19 webinar. I hope you had a great long weekend. My name is Chris Mann. I am the sponsorship specialist for the Halifax Chamber of Commerce. It's my pleasure to introduce you today to today's guest, Dallas Mercer of Dallas Mercer Consulting. Dallas is here today to talk about exposure mitigation and what businesses need to think about when developing their response plan to COVID-19. Dallas Mercer Consulting team has been busy over the last few weeks helping companies all over Atlantic Canada to stay open and reopen safely. Dallas founded the company in 2002, which has since expanded to offer safety training, safety consulting, and industrial hygiene services to 550 clients across Canada. Dallas and her team work to add efficient processes that save their clients time and money while they focus on their core business. We will begin today with a presentation from Dallas and we'll conduct a Q&A at the end. If you have a question during the presentation, please type it in the Q&A box below. If you're commenting in the chat box, I would encourage you to address your message to the panelists and all attendees so everyone can see posts that it may be relevant to all. There is also an option to address your message to all panelists, which only I and the presenter will be able to see. So let's get started. We'll pass it along to you, Dallas. Over to you.
A couple of months because our clients quickly turn to us for guidance as to how to navigate through this, and especially our clients that are in the essential service business to stay open. So our Occupational Health and Safety Division and our Industrial Hygiene Division and our Occupational Health Nursing team, I guess they kind of work together in order to help our clients. So we actually cross the lines of business that normally don't cross a whole lot in order to help our clients through this. We're quite used to doing risk assessments for our clients to mitigate hazards. We just hadn't obviously ever done anything like this for COVID-19. So we just needed to modify our risk assessment so that we were actually able to help our clients figure out how to mitigate staying open and lessening the risk for their employees or their customers to be exposed. So we needed to think outside of what the normal work environment would be. So first we had to kind of go through asking ourselves, what do we know about COVID-19 and the health hazards and the epidemiology of the disease and how it spreads? So we know that obviously there's high risk for certain, for elderly people, for immune compromised people, and anyone with an underlying chronic health condition. We also know that 80% of people can have mild symptoms. And importantly, asymptomatic people can still transmit. So that is very important to know about such a disease. We know that it's transmitted through droplets and contact. So contaminated surfaces and objects need to pay particular attention because it can survive from hours to days. And of course, in the early days prior to symptoms, it can still be transmitted. So we needed to take what we knew and the science that was out there. So we did a lot of reading and a lot of researching in the early days, just making sure that we had a current understanding. And of course, as we all know, it's continuing to evolve. So we needed to take what we knew and then start to think about workplace characteristics and also think about our workers. So, as employers, from a responsibility perspective, we all have an obligation to take every reasonable precaution to ensure the health and safety of employees. So we needed to, make sure that to the best of our ability, our clients could provide a safe workplace for their workers and customers. So we needed to put a mitigation plan in place, then figure out a way to communicate that to customers and orient employees. And also very important was monitoring and updating with new information, because I'm sure we've all experienced this over the last couple of months where information comes out and then information changes, or there's, the number of symptoms have expanded, the whole debate about to wear the mask and not to wear the mask. And then we need to make sure that there's processes in place to follow the protocols that a company decides to go with. and also what to do if there's a positive test. So, or someone within the company knows someone or related to somebody who's had a positive test, and what do you do in that case? So what does a safe workplace look like with COVID-19? So we needed to do the hazard assessment first. So as a company, what you need to do is, or as a business owner, you need to look at your business and the workplace in a totally different light than you're normally used to looking at it. So it's individual to each workplace. So, you know, don't pay too much attention to what everybody else is doing unless they're in the same kind of line of work as you, because it really, you need to take your own individual workplace. And you need to look at it through different lenses, through the lens of your employees, obviously through the lens of you as a business owner, through the lens of your customers, and what, you know, how are your customers going to interact? And you need to take into consideration the health risks and the safety risks. What kind of, so what we've been doing when we've been doing these hazard assessments, and we've been doing them in person when we can, and we've also been doing them virtually. So companies from out of province are sending us a video, and we're actually doing it virtually, walking through the workplace. We have our occupational health people, so occupational health nurses, and a safety person who does the risk assessments, and then they come up with what the risks are, and of course considering what Health Canada is saying as well, to put protocols in place for the workplace. So you need to remember that you need to look at it from a different lens. So what the employee sees is not necessarily what the customer will see. So you need to walk through your business thinking of the different, of how it's going to look. And you may not have customers in your business, so then you just need to be concerned about the employees. So once you've gone through, and you should have a list of all the possible risks from a COVID-19 perspective, then you need to assess those risks as how they relate to what do we currently know about COVID-19. So for example, and these are just some examples of the things that you need to take into consideration. Your staff, how do your staff interact with each other? What's the demographic of your staff, you know, as it relates to COVID-19, whether they have underlying conditions, whether they're an older demographic. So, you know, just looking at your own staff and their risk factors. And then how do your staff interact with customers, and what kind of risks could there be from that? You need to look at common areas in your business. Where do people typically gather? So, you know, what kinds of precautions do you need to take in place in a common area? Where people have lunch, do you need to, in some of our clients' spaces, we actually removed chairs from the lunchroom. We put chairs next to the table. We marked an X on the table so people knew exactly where they could sit to keep the physical distancing. So what do you need to do? Or do you need to rope off common areas because it's just not a safe place for people to be, because they're not able to maintain what's required and what's known about COVID-19? The entrance to your building. So a lot of times when we're doing these assessments, we actually start in the parking lot. So how do people enter the building? Is it one common entrance? Are there multiple entrances? Are you able to leave the door open? Is it an automatic door? If everybody has to touch the door to open it, how are you going to maintain cleaning that? So you need to consider that. Physical distancing. Do you operate a business where people can safely maintain 6 feet? And you just need to, you know, have some reminders in place, or is it not possible to maintain physical distancing? And then if it's not possible, then you're going to need to consider the other things from a personal protective equipment perspective, depending on the type of business that you have. Do you have contractors or delivery people that regularly come to your business? So how are you going to handle that? And what kind of protocols will be put in place for contractors? Because you need to remember that all your employees, you know, if you're putting all these processes in place for customers and for your employees to feel safe, then you don't want to erode the trust by having contractors or delivery people who are not following your protocols. So how are you going to manage that? Are you able to maintain the quality of your work? So will all these protocols somehow compromise the quality of the work that you perform? Customers and interaction. So how do customers interact with each other typically? Are they able to maintain a safe distance, or do you have to limit the number of customers that will be in your business at any one time? Smoking, if you have a place designated for people to smoke, is it still going to be safe to maintain that? A lot of the companies that we have been involved with to date have actually closed the smoking area just because it was not safe for people to be able to be in those places and maintain the physical distancing from a COVID-19 perspective. High touch surface areas, doorknobs and light switches and handrails, all the things that are high touch surfaces typically, how are you going to maintain the cleanliness and protocols for those type areas? Or are certain people going to be designated to do those things? Shared surfaces and break rooms and keyboards, microwaves, what are you going to do in those type instances from a cleanliness perspective? The mail. So we actually in the early days put a lot of protocols in place for different companies for the mail, whether the mail gets dropped off or it's picked up and how long you keep it before you open it or who is going to do that in the company. So just thinking through what you're going to do with the mail. Elevators, if you work in a company that's shared, there's shared office space, then you might want to touch base with the contractor or the building owner to determine what kind of protocols they have instituted in the building for any high touch areas that multiple businesses will be using, and the bathrooms as well. Whether there's shared tools on a work site, whether or not there's money handling and what kind of protocols or processes will be put in place for money handling. So those are just some of the examples that you will need to think about from a risk perspective, and then you need to take each one of those risks and put a plan in place to mitigate that. So some of the things you might be considering are pre-screening. So are you going to pre-screen with questionnaires or temperature checks? Is it possible to do that if you have customers entering, and is it even logical that that would make sense to do that? Or are you going to do the pre-screening with your employees, and how does that look? If you're not able to maintain the 6-foot distancing, are you going to need personal protective equipment? And if you're going to need personal protective equipment, what kind of personal protective equipment do you need? But then you also need to make sure that you have proper procedures and protocols in place for donning and doffing the personal protective equipment. Because if people don't understand how to use it or how to put it on or take it off, then they can also put themselves at risk. And also procedures for storing and handling the personal protective equipment. So if indeed you do need to have that, you need to think about those processes. Cleansers and sanitizers. So they need to have a certain percentage of alcohol. You should check with Health Canada for any of those that you have, so that you can make sure that the DIN number matches what's approved by Health Canada for COVID-19 to, that works best. And then where are you going to locate them within your organization, sanitizers? Are you going to have them in the bathroom, out of the bathroom, all the kinds of things that you need to consider. Hand washing stations, as we know, washing our hands with soap and warm water is the #1 thing we can do. So, do your employees have access to hand washing stations, and where are they located? And making sure that there's lined garbage containers to throw out the paper towels after they dry their hands. Physical distancing. Are you able to maintain physical distancing? So you might actually have to put markings in place or remove some equipment or move some workstations. So how can you, physical distancing is the best thing that you can do if you're able to do it. So, can you reorganize your workplace so that employees can maintain the physical distancing? A lot of companies are engineering out the hazard with isolating people from the hazard. So I'm sure we've all seen in the grocery stores the plexiglass for the cashier. So, is that something you're considering, and are you able to do that? Signage is really critical right now. I don't think that you can have enough. Everybody's looking for signage. I know when I go to a grocery store or a drugstore right now, I'm looking for the signage as to where to stand, what I'm supposed to do. So people are looking for direction now because they know that you've already taken the steps. So there's a lot of trust going into that right now with going into a store, and the stores that are that have those processes in place, you feel safer when you're there. So making sure there's signage, not only for telling people where to go, but just reminders for people as well in the bathrooms for how long you should have the water running to wash your hands, and and we're, safe protocols or etiquette for sneezing and coughing. So it's just good to have lots of reminders right now for people, so that they know you've thought those things through. The number of people in your building you may need to have, or in your office space, you may need to limit the number of people and have people come in different days. You may need to stagger the start dates, start times, so that people come in at different times and there's not a lot of people gathering at any one time. So figuring out the logistics of how that will look with, depending on whether or not you can have everybody in, or you need to alter that. Some companies have foggers as well for sanitization. So depending on where you live, you may be able to access those. You need to certainly consider and give some time to the whole washrooms, how many people you can have in there. Most of the companies we've worked with, we're only allowing one person in the washroom at a time, just so that people feel safe to go to the washroom. So you need to figure that out, and then you need to figure out how you're going to communicate that. Which brings me to the next slide, which is communication. Communication will be critical for easing the anxiety for your employees and your customers. There's a lot of rumors out there. There's a lot of misinformation. So, the communication, once you've gone through your risk assessment and you've gone through the process of figuring out how you're going to mitigate the risks that are within your business for your employees and for your customers, the communication piece is critical. It will impact your employees' anxiety, their mental health. We need to be very mindful that everybody is going through this pandemic in a different way. We're all experiencing it differently. So, how you communicate this will determine how you move forward. There are certain provinces where you need to submit your plans ahead of time, and there's certain, and in some cases, you need to have your plan available in case it's asked for. So you do need to take the time to go through the protocols and put your process in place. Not only is it required in a lot of cases by a lot of provinces, but also it will ease the fears and anxiety of your customers and your staff. Also, you need to think about how you're going to communicate it to contractors or people who bring deliveries. Do they have a protocol in place at their business, or, communicating what the protocol is going to be at your work site. And this is important because employees are going to be paying attention to how everybody else is following the protocols. So you can't afford to have contractors in place who are not following the protocols, because that will quickly erode the trust of your own employees. I think it's a good idea to have two-way communication. So give your employees an opportunity. I know some companies are sending out surveys to their employees ahead of time to ask them how safe they feel about coming back, or are there any particular issues or concerns. Or you might just want to have a chat with people, or some kind of a way to have a meeting with them to ask what concerns they have. I think it's good to do that during the risk assessment, because they might also point out places or areas of concern to you that you may not have considered or taken into consideration when you were doing the assessment. And of course, a good degree of common sense is always important. And remember that, everybody is each province is going through this phased approach differently. So what's allowed in some provinces is not necessarily allowed in others. So you need to take into consideration, of course, what your own government is stating that and what the rules are. And don't relax any of the rules unless you communicate them first. So as the provinces are doing better, and they're, and things are changing, make sure that you communicate to your staff and to your customers, what changes you're putting into place if you're going to relax things, because you can make people very nervous if you're relaxing things without communicating first that you're going to change something. And this is an evolving situation, so things are changing all the time. When we first put mitigation plans together, the symptoms are different now, so we have had to update the mitigation plans because the symptoms for testing have changed. So you need to stay current as an employer as to what's happening, especially as it relates to your particular industry. You might choose to do your communication online. You might choose to update your website for your customers so that they can go and see what the protocols are when they arrive. It's good for people to know that. Some people are having people greet the customer so that when the customer arrives, they're told what they have to do and how they have to move through if they're a customer in a retail, how it looks when you get inside. So, whatever you determine, your employees best, so how best to communicate with them to make them feel safe to return, and also your customers. So you need to think through what they will be thinking or how best to communicate with them. Once you do have your plan in place and you have communicated it, you need to update it regularly. So keep everything current. As I've stated a few times now, that this is an evolving situation. So you need to just stay as current as you can, providing regular updates to your staff and your customers. And again, don't relax without communication. So monitor for best practices, because different companies are doing things differently, so we can all learn from each other. And now I just want to mention about following the protocols and the process. So everybody must follow the process that you put in place, with no exceptions. So the owners and the CEOs don't get a different set of rules as to all the staff. So if there's protocols put in place for safe distancing, then you need to maintain that. Everybody in the company does. I would suggest that you probably should, in advance, think of a disciplinary protocol for customers and employees who choose not to follow the protocols, because again, one person choosing not to follow the protocols, one employee, will quickly erode the confidence in the company as to how you deal with that. So you might want to think through and also communicate upfront that, look, failure to follow the protocols will result in whatever your disciplinary process would be. A lot of companies that we've put the processes in place are having a zero tolerance. So people who don't follow will have to leave, whether that's a customer or whether that's an employee. So recommunicate your plan and your protocols as changes occur. Know when to advise your employees to call 811. Don't take for granted that people understand all this new terminology with safe distancing and self-isolation and quarantine. So you might want to provide some definitions in your plan. And obviously Health Canada has lots of areas where you can find these definitions. So you might want to include that in your mitigation plan. And include a section, of course, for worker responsibilities, as I just talked about, making sure that they understand what their role is and what kind of discipline there will be for not following the rules. You'll also want to include protocol, depending on what kind of business you have and whether or not personal protective equipment will be required. You'll also want a protocol for putting on and taking off the personal protective equipment safely. And if some of it is going to be reused, then how are you going to safely store that personal protective equipment so that it is safe to reuse? And then lastly, it's important to have a response plan. So, and I guess this is something that we didn't really do in the early days because we were busy trying to put protocols in place for companies to stay open, especially companies that were providing essential services. And now we've moved into helping a lot of companies reopen. Just making sure that you have a response plan in case something does happen in your organization. So know who's going to communicate to the employees and to the customers and have it in advance. I think it's safe for everybody to operate under the premise that you're going to have a positive case within your organization. And if you operate under that premise, then you'll do this ahead of time and you won't have panic. So we've been through the panic with some of our clients over the last few weeks where people were being called in the contact tracing, were being called to be tested. So companies panicked in knowing what to do and how they should talk to their employees about that, or how they should talk to our customers about that. So I think it's very valuable, having gone through it, to have your response plan in place ahead of time. And public health, of course, will provide the instructions to what you have to do and whether or not you have to help them with any of the contact tracing. I think that it's also critical to remember that this is somebody's personal information. So, treat it like you would any other illness and be sensitive around that. I know that we're doing contact tracing, so people are going to be aware of who it may have been because they may have been close to them during a specific time, but just be sensitive to the fact that, it is somebody's personal information, and be mindful that that person is probably going through a difficult time. Obviously, they could be sick or symptomatic, but also that they may be concerned about their parents or children or anyone that they may have been in contact with. So it might be beneficial to actually assign a response team. And we have a lot of companies who did this, big or small. In some cases, the response team, people had many roles, but assign someone who's going to lead it if in fact someone in your organization is called for testing or has a positive test. So you might be involved in the contact tracing and tracking. So, just knowing ahead of time where employees were sitting or what they, different types of work they may have been involved with, who they may have come in contact with. So, if someone could be involved with that or assigned to that, I think it would be important. There might be a local agency that you have to report to, like food inspection agency. So who's going to be responsible for reaching out to them? Who's going to call public health and be the liaison to determine, whether or not you need to close, whether or not you need to do a deep clean, and they will provide the direction on that. Who is going to communicate with the affected person? You might want to have some questions prepared beforehand. Who is going to talk to other staff? It could all be the same person, depending on how many people you have in your organization, or who is going to talk to customers, or what kind of messaging are you going to have for customers or the public, if indeed that happens. Making sure that you have a sanitation company that you have in your Rolodex, so that you can reach out to somebody to come and do a cleaning, and what kind of business you have. So, just knowing in advance how that would look, or how you would need to do that, instead of scrambling and panicking and looking to find numbers when you're already in the situation. It's better to have a response plan in place while you're calm and you can think it through than being in a panic. So who's going to be gathering information? Somebody might need to, have a look at the floor plan or the employee's workstation to see who would have been around them or who would have been in their space. If it's in a case of customers, is there any way that any tracking can be done? And of course, the public health will help you through that. But it's just good within your own organization if you can think through who you would want to be involved in managing some of that for you. And as I said, I think it's best to assume that you're going to, we're going to be in this for a really long time. So I think if you can think through that you're going to have a case and figure out how that looks, then you can avoid a lot of panic and scrambling later on. Okay, so that's the presentation. I don't know if there's any questions.
Yeah, so Dallas, thank you. That was amazing. There was a lot of great detail there. I know, our team ourselves at the Chamber, we're putting together a task force and working very diligently on how we get back and reopen. So a lot of helpful tips on there. So I appreciate that. We do have a couple questions here, but I do encourage, we do have a number of participants here, so please fill in the Q&A at the bottom, and if you have a question, be happy to answer it. So one question we have is, a lot of our Chamber members are small businesses. Mm-hmm. So if they haven't been open during this time and they're looking to reopen, a lot of the steps that you mentioned, they may not be able to, afford, let's say, hand sanitization at every station, PPE for everyone working. So is there any options that they might be able to do if they don't have a big budget to cover the cost for that kind of stuff?
I think it's really hard to say that categorically. I'd need to know the business. And I mean, you can feel free to reach out and ask questions personally as well after the session. I certainly don't mind having a chat with someone to walk through a few things. I think it really depends on the nature of the business and the risk. So I think you need to first figure out what kind of a risk your business poses and how can you mitigate the risk. I mean, it's always better to engineer out a hazard. So, how can you engineer it out and still maintain the integrity of what the business does? So, if you don't have a big budget for things, then you'll need to figure out what's logical and how can it make sense to keep people safe without having to get into all the personal protective equipment and those kinds of things, because those are expensive. And I certainly, in my 18 years of having the business, I've seen an unbelievable spike in the cost of everything as it relates to PPE and hand sanitizer. And I mean, it's just crazy. So, I do fully appreciate that there's a big cost associated with this. So, what can you do logically that can keep people safe without having to spend all the money? I think you need to You just need to look at the risks within your own business and figure out how logically you can do some things.
Okay, great. So another question we have is in regards to like the 2-meter rule or the 6 feet rule. How strict do you think businesses should be if you're operating in an office environment? Do you literally get out a measuring tape and measure between desks to ensure that it's 2 meters apart? Or
Well,
are
that's
you
what
able
we've
to?
done. Yeah, we've
Okay.
actually, every risk assessment we do, we got the measuring tape out, because
Wow.
that's what the rules are. So, but it depends. I mean, obviously, in my particular office, we all got our own offices with doors. So, it's easier, obviously, when you have that kind of an environment, and, and we're the only ones in this building. So you need to think through whether or not there's multiple businesses in the building and how you can maintain that. But yeah, we've been following the 2-meter rule. I mean, even here in the lunchroom, we got we've taken out half the chairs. And yeah, right now depending on what phase the province is in, we're following those rules.
Okay, great. So you mentioned a lot about communication and how communication is key, and I think that's in every organization outside of COVID. It's key to be successful. Being transparent, how transparent do you find, or are you advising your clients to be in terms of any of the communication that they're giving? Should they, if someone is being, a little bit apprehensive of coming back to the office, is that an open conversation, or is that something that people are having just on a one-on-one basis?
I think it really depends on the nature of the business and the employee and what their concerns are. I think, employers and business owners need to be extremely empathetic right now. As I stated in the presentation, we're all going through this differently. Some of us have underlying conditions, or some of us live with elderly parents. So people have a lot going on right now, and their kids are home, and they're, they could be in small spaces. So, I think we need to be really empathetic. I've said to some of my clients, your empathy needs to be on bust right now, because, we need to be mindful that people are under a lot of stress and have a lot of anxiety and fear. And so I think it really depends. I think being open as possible, a lot of companies are sharing the full-on risk assessment that we're doing with all their staff, just so that, because when you do a risk assessment, everything's on the table for how you can mitigate it, but some of it's not logical to do. So we might recommend that, you need to do temperature checks, and they might say, well, we can't do temperature checks because of this. So, sharing that risk assessment so that your employees know that you've thought through it all, I think can be a really valuable exercise. But you also need to be prepared to say why you can't do some of the things that we may have recommended. So it's a bit of a double-edged sword. But I think people are really appreciating the openness and the honesty with companies saying to employees, I'm not sure how we can do that. What do you think? So there's been a lot of back and forth. I said some companies are sending out questionnaires to their employees, and some are doing it one-on-one, just having a conversation to try to allay their fears as to the risks and concerns. I think in Atlantic Canada we got a bit of an advantage just because the numbers are going down, and the number of active cases are going down. So that gives a little bit more leeway, I think, for people to be able to have those conversations with employees. Knowing that the numbers are not increasing, they're going down. So I think, but I think being as open and honest, and it depends on the employee. You might, some employees you might be able to talk to in certain ways, and some employees you might need to have a one-on-one phone call or a Zoom call with a group so that people can express their concerns. I mean, we're all, getting tired of the Zoom calls, but I think that, I think there's a lot to be said for making sure you're transparent right now.
Okay. So here's a question, and it's going to kind of put you on the spot a little bit here. So you represent all of the land of Canada. So your colleague Samantha's in New Brunswick, I'm in Nova Scotia, you're in Newfoundland, and we always want to remember PEI as well. So is there anything that a particular province may be doing right now that might be better than what other provinces are doing that you're seeing from your opinion?
That's a really good question. I think I don't see anything that's really stark to say, oh, they got it down. I think it's all, I think once you get into the workplace, it all looks the same in what you need to do to mitigate the risks. I don't, and it's all it's all out there anyway, from Health Canada and the World Health Organization. I mean, the resources are overwhelming, and that's part of the problem. It is overwhelming. So, and as you said, some of the members are small businesses, and trying to read all that information can be overwhelming, which is why, we spent many weeks working with companies and then said, you know what, we need to put this out there so companies don't get so overwhelmed when they're reading all that information, and let's just give them some steps so that they can try to figure it out on their own. But I haven't seen anything, that I think New Brunswick got some good prescriptive stuff. If you go on the government website for some of the businesses that I think might be helpful. I think some of the provinces are playing catch up, but it all really looks very similar. God, you'd like to see them all sharing information right now, because it would really be beneficial. There's no need to be territorial now. So no, I can't really say. I think there's different protocols for different provinces. I know in New Brunswick, you got to have the plan, and you don't have to submit it ahead of time. Depending on the industry, Newfoundland and Labrador, you do have to submit it ahead of time. And right now we've submitted them all. So every mitigation program we've done for a business, we've submitted it just to ask for guidance. Are we doing it right? So, just to be sure.
Great. So another question too is, for larger organizations where like they're working in a warehouse or a factory, where social distancing may be harder to implement or almost impossible, is where should organizations start, in your opinion?
Well, I mean, you need to break it down to watch. You need to watch the tasks. So you need to have a look at what is the movement in a warehouse or in a factory. How do people get in? Where do they stand? So some of our clients in processing type manufacturing industries have installed plexiglass on wheels, so that the plexiglass just gets wheeled in to divide when the people are on a line or in a factory type setting, and it can be moved to a different area if they need it. And then when they're moving between tasks, they wear a mask. So so I think that it really depends on what the organization is. So you need to break down the tasks to figure out, because we've gone into some organizations where they said they can't do the physical distancing, but they can. They just needed to look at it a different way. So with a little bit of guidance and a little bit of maneuvering, we have been able to put the physical distancing in place. But in some, we haven't been able to. And where we haven't, then they need to wear personal protective equipment, or you need to do the isolating like the plexiglass.
Cool. I really like that idea of moving plexiglass. That's pretty cool on wheels. Never would think of that, but that's a really good idea.
A lot's happened in the last 8 weeks, Chris.
Yeah, absolutely. So we do have a couple questions coming through here. So can you state again what provinces require employers to submit their risk assessment and changes in advance?
I'd have to look that up to be sure, just because it's changing. So as of today, I know that New Brunswick needs to have it, but they don't need to submit it. Depending on the industry, in Newfoundland and Labrador, you do need to submit it, but it's broken down depending on the type of work that you're doing. But in all cases, you still need to have them. So you need to have a written mitigation plan available in case they come to the work site to see it. So it changes, but in all the provinces, you need to have a plan.
Okay, great. And another question here from our participants. You said that Newfoundland companies have to submit their plan to government depending on their industry. Do you know what industries have to submit a plan?
I would have to go back through that. It has changed. So it was the essential services. So the fish processing, for example, they had to submit a plan before we could operate, which we did. And anyone in the food type business had to submit the plan to Occupational Health and Safety, and then Occupational Health and Safety in turn reviewed the plan with the health officer. But that's, a lot of the companies are not doing that now. They're just having them available, and if requested by Occupational Health and Safety, they're providing them.
Okay, great. One question from a business owner point of view. So say that you talked about possibly when we reopen having a stagger approach to shifts. From a performance piece, you know, one thing that may be difficult for a business owner is if everyone's kind of going in at different times and they may not be working collectively as a team, how do I maintain that culture and that performance? Is there anything that you could use as piece of an experience from companies that you've been consulting with?
Uh, that's an interesting question. So I think people have just been maintaining the digital connection with people who are not in the office, just maintaining the opportunities to have the team meetings, or if people are collaborating on a certain piece of work, just making sure there's time set aside during the day that they can have conversation. But I think it's really dependent. I mean, we have not been monitoring and managing that for companies. Obviously, our
Yeah.
role has been specifically to look at the safety and the COVID risk.
Hmm.
So I'd almost have to go back to companies and ask that. That's not
Right.
something that I'm not in that business.
No, I just wondering from experience where you're dealing with so many companies, if they've said
Yeah.
anything about that, because I know that's, you know, some of the concerns, you know, with businesses and their performance. Another piece that you mentioned in your presentation was around signage and how important signage is, and it's everywhere now in groceries and everything. Again, being a small business, if you don't have the ability to afford, you know, fancy signage or decals, what's another avenue that you could go down?
I've seen all kinds of things. So, people using Bristol board, I've seen lots of different things for signage. I don't think it matters as long as it's good communication and it's clear, common sense type approach. I haven't, I've seen everything. So I don't necessarily think that if you don't have the finances that you need to spend all that money on the fancy signs.
Okay. So I believe that's it from our questions that we have, and there's no questions coming through with the from the participants. So before we kind of close out and wrap up, is there any one piece of advice that you give out of everything that you've given us in your presentation today is something that is the most crucial piece?
I think just take the time to look at your business from a different perspective, and think of it. Look at your business through the eyes of your employees and your customers as it relates to COVID-19, and understand where the fears and anxieties might be.
Okay, that's great. Well, again, let's wrap up. So thanks so much, Dallas.
Thank
We
you.
really appreciate this, and it's a wealth of information. We're definitely going to be going back to the recording on this. Thank you to all our participants for joining us today. We're hosting many more webinars every week with experts in economic recovery, marketing, and reopening processes. So head to halifaxchamber.com/events for a full lineup. And this webinar, as I mentioned, is recorded and will be available on our YouTube channel tomorrow. A link will be sent to all attendees as soon as it's available. So thanks again to everyone for joining us today, and I hope you have a great day and a great week. Thanks so much.
Thanks, guys.
Thank you.